Hi, this is Chuck Jones. I want to apologize because we experienced some technical issues this week and lost our video feed, so we've pasted a screen grab as a stand-in for the video. We managed to save the audio and apologize for the inconvenience. Hope you enjoy this episode. Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and we're joined again by our expert guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the Patient Education Specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book No Time to Teach, a source for many of our topics here on the Patient Educators Update. And we'll tell you a little bit more about Fran's book as the show progresses. Fran, today we're going to talk about a new link for patient education. We've often talked about it being something that you shouldn't do in the last 11 minutes of a hospital visit and this, that, and the other. And today we're going to try to get a link that everybody in the business can relate to. You know, often a lot of the folks that we talk to relate patient education to a handout that you go over with the patient right before they go out the door. And we know that that's not the best way to do it. And it's almost tantamount to providing an overweight person with the diet advice that says eat less, move more. And we know that that doesn't work because it's not applicable to everybody. Some people it just doesn't work, and some people need something different. The underlying message here is that all of these things have to be individualized and specific to each patient, because not everybody's the same. And thus there's a term that pops in there, an acronym called PRN. And I got interested in this while looking for something different for another show topic, and want to talk about what PRN means and how it applies to patient education. So I'll go to the dictionary. I went and looked it up. And the reason I went and looked it up is because I found some forums where there were nurses asking what PRN meant. Probably younger nurses, probably heard the term in nursing school, but never knew PRN meant anything. You know, it was just an acronym that everybody used. So PRN comes from the Latin. The term PRN comes from the Latin pro re nata, and I hope I'm pronouncing that right. But it's a phrase that means in the circumstance or as the circumstance arises. It's as commonly used in medicine to mean as needed or as the situation arises. And it's also used in medication. I've seen this written on a lot of prescriptions, especially those with pain. PRN means as needed. Now, I will relate this back to you. You've often talked about what if a nurse has to administer pain medication, and it's PRN, what do they normally do before they administer pain medication?
They assess the patient.
Exactly. And why do they do that?
Well, you don't know if it's needed if you don't do the assessment.
Yeah.
And as you're pointing out, it's exactly the same for patient education. Yeah,
exactly. And so today you and I are now proclaiming patient education as PRN.
and I would say it's PRN as well as prescribed. So it's the same as pain medicine in that there's usually a prescription for a pain med right after surgery because certain levels of pain need to be prevented. So you keep the patient medicated for a while. And then as the patient starts to feel better, we move on to PRN pain meds so that they're just given as they're needed.
Right.
The same could be for patient education. Clearly, there's patient education that must be done, informed consent, before you move forward. And then assess the patient, continue with the conversations, and teach as needed.
Yeah, and there's some very good reasons for that. Number one, every patient is different. We're not all alike, even though lots of people that look at numbers and surveys and take polls and things of that nature want to lump us all into big groups. We're not. Every situation is also different. Every disease is different and often compounded when you add multiple chronic situations on top of that. You know, the person who's diabetic who also has cancer or arthritis on top of another disease, celiac or something like that. So it's not a simple, eat less, move more type of thing. And the only way to properly administer patient education is going to be on the circumstance or in the situation, because you've got to find out what are all the circumstances that are going on with this particular patient and their disease before you can determine what education is necessary. And then there's the other issue with, we talked about the patients being different. Well, their involvement in their own well-being will be different. Some patients you can't change from anything, and others will read the internet and talk a blue streak about stuff that they've read.
And also their level of understanding. You need
Yeah.
to figure out how much they know already and how deeply they understand things, and then you can present it as needed
Yeah.
in the way that will work for them.
Yeah, because it's one of those things where, and you've actually talked about this, and I've been able to relate situation with my wife where the nurse can't come in and start talking and educating the same to every patient without knowing what they are. Because when my wife has been in the hospital, she's a diabetic, and they will start talking to her about her medications and this, that, and the other, and she tunes them out because they're not even checking her understanding, because she knows a lot about her disease and what she needs to do. So it's really important to get the trust level of the patient by listening and trying to find out what's going on. So let's take this whole concept of patient education as PRN to heart, and ask you, number one, how would you administer patient education PRN?
Well, I think what it means is that you need to do an assessment.
Mm-hmm.
You need to know where the patient is. And then PRN, you also need to individualize the intervention so it's appropriate as needed for that patient. So it really talks about listening and paying attention and teaching in the teachable moment and doing what's right there.
Yeah, and one of the things you have to determine is let me put it this way: your goal shouldn't be to determine if they need patient education. Your goal should be to determine what they know and what they don't know, because I've heard people talk about, well, the patient doesn't need education. Well, how do you know? Well, I asked them if they had any questions, and they said no.
Right. But it's the same thing with pain. I like the analogy there, because a patient may say he doesn't have pain because he might not want the opioids as treatment, but you could see the distress, the tightening, the inability to sleep. So your assessment includes what your observations are, as well as what the patient is saying.
Yeah. Now, can you think of any specific advantages or disadvantages to taking this PRN approach? Is there a reason not to do it? I don't think so.
I think you need to combine it with, what you absolutely need to make sure the patient understands. So it needs to be both. PRN is probably most applicable when you're talking about are they ready for it, and how much are they ready for, and what are they ready for? So you can better individualize it. It reminds you that you need to assess.
Yeah, and that's a good point, because so often, especially right after admission to the hospital, there is so much going on, and the patient may be at a high level of anxiety or anticipation, and so not in a proper frame of mind to be able to absorb much. But that is a good time to at least try to get them talking and answering a few questions to learn as much as you can about their situation, so that when the time comes, you can do a better job, correct?
Yeah. And to pay attention to the patient, both the nonverbals and the verbals, to see what's right when.
Yeah. Okay, cool. I suspect that we will address this particular approach more often as we think it through a little bit, but I think it's just spot on for a good way for nurses and physicians and those who are doing patient education to think about the situation. It's not about the handout. It's not about the video. It's about the patient. And if you set it up in your own mind for as needed, as required, and within the circumstance, you will first look at the circumstance and do what you want everyone to do, which is make the assessment first and do it often to make sure you know where they are and what they need, right?
Yeah, and that supports patient-centered care too. It just all pulls together.
Yeah, it really does. It really does. Excellent. Okay, good topic. We'll talk about it more in the future. So why don't you tell folks a little bit more about how they can find you online and learn more about some of the No Time to Teach philosophies?
Well, I've got a blog at notimetoteach.com, and I'm on Twitter at No Time to Teach.
Okay, and your book, No Time to Teach, which I frequently forget to mention, was the 2010 Book of the Year by the National...
The HAN.
Yeah, HAN. Yeah, and if they didn't think it was a good book, they wouldn't have designated it so. So very worthwhile. Now, your book is available at Amazon and other book retailers and online sellers. It's available in paperback and ebook form. And for those that want to use it for in-service and for group teaching, you can get a sizable discount on a bulk purchase by visiting your publisher, Pritchett and Hull, and their website is p-h.com. So go there to save some money. And for those of you that want to add some additional excitement to your patient education, we recommend video and video on demand. It can be a great time saver as well as a great opportunity to provide additional knowledge to your patients. And you can learn more about our system, MMDS, Medical Media Delivery System, at our website, synergybroadcast.com. So, Fran, this is a great topic. Patient education is PRN, and we will talk about it more in the future. So thanks much, and we'll talk to you next time.
Okay, bye, Chuck.
Bye-bye.